Well, good morning. The subcommittee will come to order. I want to welcome all of you to today's hearing, and intent, of course, the hearing is to examine the Food and Drug Administration's fiscal year 2017 budget request. And in addition to this committee's review of the budget request, the members of the committee will seek information on the agency's use of current and past resources, including activities, policies, practices supported with the appropriated funds. Our witness today is Acting Commissioner of the Food and Drug Administration, Dr. Stephen Ostroff. He is joined by Mr. Jay Tyler, the Chief Financial Officer for FDA. And I would note that we're pleased to see the Senate confirmation of Dr. Califf yesterday on the permanent position of the FDA Commissioner. During the transition period between Dr. Ostroff and Dr. Califf, I believe we're in good hands today. So thank you all, both you and Mr. Tyler, for being here today and for your presence. As I mentioned in previous hearings, we have established basically 4 primary goals for this subcommittee as we progress through the FY17 hearings, which we are sort of right in the middle of right now. The first goal is increasing oversight, efficiency, and the need for effective outcomes. The second would be keeping rural America vibrant. Number 3 would be supporting American farmers, ranchers, and producers. And number 4, protecting the health of people, plants, and animals. Given the myriad of responsibilities assigned to the FDA by the Congress, there is a constant need for this body to increase our oversight. Our oversight not only covers the expenditure of resources, but also the corresponding activities, the efficiency in delivering those services, and the degree in which the agency delivered or failed to deliver meaningful outcomes. At the end of the day, our constituents demand that limited resources are spent wisely. For example, in the FY16 Omnibus Bill provided FDA's full funding request to continue the implementation of the Food Safety Modernization Act, which we call FSMA. Your FY17 budget request proposes a total increase of $212 million for food safety, yet the committee is still in the need of the proper accounting for food safety expenditures in and for the current and past years. While you have provided us with more detail on your spending plans than in the past, we will continue to require regular updates on your use of these funds and what you're accomplishing. FDA's FY17 request includes a modest increase in budget authority, and that's actually more closely reflects the debt crisis that is facing our nation. Our nation's over $19 trillion is debt, as most of us know, and it requires us to trim government spending where we can and to decrease the growth of government at least at a minimum. FDA is proposing discretionary increase of $31.2 million and reductions in the amount of $21.1 million for a net increase of $10.1 million. It is worth noting that the total resources in this request represent a 21% increase above the FY12 budget request. And looking at the proposed user fees, FDA is again proposing to collect and spend $202 million for new unauthorized programs. While there is a time and certainly there's a place for user fees, as demonstrated by the success of most of FDA's user fee programs, FDA provides no evidence to demonstrate that current efforts are effective in assisting the intended beneficiaries and that the resources requested for the new user fees will actually result in better service for the customers. In addition to the President's FY17 budget request, Congress received the administration's request for approximately $1.9 billion in emergency appropriations in response to the spread of the Zika virus. I want to echo the remarks made by Chairman Rogers of this committee and also 2 of our other subcommittee chairmen that the most expeditious way to respond to the disease is by the use of unobligated funds that are previously provided for the Ebola response in FY15. In fact, in January of 2016, FDA had far more unobligated funds left over from the Ebola appropriation than the total request for the Zika virus. This is yet another example of an institution in which the administration should utilize existing resources rather than coming to Congress for more money, which actually in the end compounds the nation's debt. Another goal for the subcommittee is protecting the health of people, plants, and animals, which is also the main mission of the Food and Drug Administration. The United States has one of the safest medical product markets and one of the safest, most highly productive food and agricultural sectors in the entire world. The United States government plays a unique role in ensuring that all of these sectors maintain their current vitality. We must continue to explore ways in which the FDA can fulfill its public health mission successfully, but do so in a way that the regulated industry has clarity on the rules of the road and they're not burdened down with unnecessary regulation. Since FDA is informing Congress that the food safety, the medical product safety, and rent and infrastructure needs are the highest priorities this year, it is incumbent upon FDA to prove to Congress that such priorities can not be funded out of the base resources first and foremost. In addition, the agency must demonstrate that all efforts have been made to review current operations for any additional savings and efficiencies. Lastly, the subcommittee and the American public need assurance that the agency is coordinating and not duplicating other efforts across Health and Human Services, USDA, and elsewhere to ensure the most efficient means of accomplishing its mission. We hope to touch upon each and all of these issues more in detail as we move forward with the questioning portion of this hearing. Food and Drug Administration must also tighten controls for areas subject to large expenditures, which with unclear results and where performance tasks or milestones are not met, such as information technology. In closing, I want to note that the work you and your colleagues perform at the Food and Drug Administration touches the lives of every American, and we appreciate your dedicated service. Without question, you have no shortage of work to do at FDA, and there are many challenges facing your agency, from food safety to opioid abuse to antimicrobial resistance, and that's just to name a few. We look forward to hearing from you today as we proceed with the remainder of this hearing, and about your funding proposals for the future and for what you're doing with available resources in the current year. So with that, let me ask the ranking member of this subcommittee, Mr. Farr, for any open remarks that he might have at this time.
Well, thank you very much, Mr. Chairman. And Dr. Ostroff, before the new commissioner takes hold, I just want to thank you for your public service and for your standing in and doing a great job.
Thank you.
I really appreciate it. This is my last year in Congress and in this committee, and this is one of the areas I think when I came to Congress I knew very little about the FDA. It's probably been one of the most fascinating agencies that I've held to deal with, because I find that the responsibility you have just touches all aspects of our life. I had no idea how broad the responsibility was, not only from food safety. I always thought the Department of Agriculture did food safety, but it's FDA that does food safety, except for poultry and meat and eggs. Drug development, everything that's out there, all those damn television ads on drugs, all of that has to go through you. Even pet food standards and sunscreens and beyond. So the mission you have is huge, and I think that unfortunately, despite what the chairman says, I think we give you awfully short shift, but we ask a lot and give you very little money to do it. Big mission, small budget. So I'd like to explore that today, among others. And I really appreciate your help in helping us understand the interplay between the FDA mission and available resources, because I think we're asking a lot without a lot of money to be able to do it, and I'd like to learn something about the backlog and stuff. So I'm ready just to move into the questions, Mr. Chairman.
Sounds good. Well, Dr. Ostroff, also I want to say thank you for your work in your interim time at FDA. You've been certainly a pleasure to work with, and always very reachable, and thank you for also reaching out to me on many occasions as you have done your work over there. So without objection, your entire written testimony will be included in the record, and we'll recognize you for any statements that you want to make before we go into the question portion of the hearing.
Well, thank you so very much, Chairman Adderholt and Ranking Member Farr and other members of the committee. As you know, for almost all of the past year since our last budget hearing, 2015, I have served as Acting Commissioner of the Food and Drug Administration, and I can tell you I was also very happy at the confirmation of Dr. Califf yesterday, as you mentioned, as the Commissioner of Food and Drugs. I've had the pleasure to work with Rob for the past year and think his selection is really quite an inspired choice, and I am thrilled with the bipartisan show of support for him and for the agency. And I very much look forward to handing over the baton to him in the not-too-distant future. So this particular testimony and hearing will likely be one of my last acts as the acting commissioner, and I would very much like to thank you for giving me the opportunity to appear before you today to discuss the President's fiscal year 2017 budget request for FDA. Words cannot express how extremely proud and grateful I am to have had the distinct honor of being here today to represent the thousands of talented and dedicated men and women at FDA and the tremendous work that they do. This work occurs day in and day out in service to the health and well-being of the American people. I would like to very much thank the subcommittee for its past support of FDA, most recently through our FY 2016 appropriation, which is so very helpful in meeting the demands of our increasingly complex and diverse mission at home and abroad. Your commitment recognizes and reaffirms FDA's critical and dynamic role in protecting and promoting the public health by ensuring that the food we eat is safe and nutritious, our medical products are safe and effective, and that we can reduce the harms associated with tobacco. Our mutual goal is that every American has full confidence in the products that we regulate and our ability to respond to new responsibilities, new challenges, new science, and new opportunities both at home and abroad. After all, there are few other federal agencies, as you mentioned, that touch the lives of Americans every day to the degree that FDA's do. It is a great responsibility, and it's one that we take very seriously and we never forget. Our accomplishments over the past year have been as substantial and as impactful as at any other time in FDA's recent history. My written testimony includes a number of examples of our achievements across the range of the products that we regulate, and I cannot possibly cover them all in my oral statement. Suffice it to say that we have continued, without missing a step, to make a substantial and positive difference in the lives of those that we serve, even during a period of transition in the leadership of the agency. Among the accomplishments that I will highlight is that we had another banner year in the approval of new drugs and biologics for therapeutic indications that range from the rarest diseases to the most common diseases to the most severe diseases. Some of these drugs have absolutely transformed the way that these diseases are treated and provide options that were not previously available to those who had little to no hope of having their diseases addressed. We accomplish this by being able to take advantage of innovations in the regulatory process that allow us to get these therapies to patients in America faster than any of our regulatory counterparts. And we accomplish that speed without sacrificing our high standards that sponsors be required to demonstrate safety and efficacy of the products that we review and approve. Last year, we also approved the first biosimilar in the agency's history. We continue to take action to identify and protect the public from poor quality compounded drugs. We've taken major steps to address the growing problem of antibiotic resistance in human and agricultural settings. And last year, we brought all uses of antibiotics in food animals under the supervision of veterinarians. And at the end of this year, growth promotion indications will be voluntarily removed from the labels of all medically important antibiotics used in veterinary medicine. In the last year, we made major contributions to the response to international health threats like Ebola in West Africa, and today we are working very diligently with our federal partners and outside stakeholders to address the recently recognized threat from the mosquito-transmitted Zika virus. And in recognition of the growing consequences of the opioid epidemic, a problem which has touched the lives of far too many families and affects nearly every community in this country, we recently completed a comprehensive review of FDA's activities and announced a far-reaching action plan to ensure that the way we review, approve, and oversee these drugs contributes to ending this crisis. It is a plan that focuses on actions that can help us positively impact the epidemic. while still providing patients in pain access to effective relief. It includes such actions as considering ways to widen access to antidotes to treat overdose, encouraging development of better products with abuse deterrent characteristics, including generics, strengthening and expanding warnings, expanding input through wider use of advisory committees and tapping the expertise of the National Academy of Sciences, requiring additional studies by manufacturers of opioids to fill very critical scientific gaps in our understanding of these products, considering expansion of the REMS for this class, and encouraging development of innovative medication-assisted treatment for dependence. It also includes working with and supporting partners inside and outside of government to assure a multi-pronged approach to this problem. FDA's budget in support of our responsibilities remains a bargain for every American taxpayer. While the products that we regulate account for more than 20% of every U.S. consumer dollar, individual Americans pay only 2 cents per day to support our oversight and ensure that these products work as they're supposed to and are safe. It's a small price for life-saving medicines and for medical devices, for confidence in medical products that are relied on daily, and for a food supply that is among the most diverse and safest in the world. FDA's 2017 budget request was constructed to ensure that we maintain this level of success while recognizing the tough fiscal environment by focusing targeted increases on the most urgent needs. The total budget request for FY 2017 is $5.1 billion, which represents an overall increase of 8%, or $358.3 million, compared to the FY 2016 enacted level. This includes $2.7 billion for budget authority, a very modest increase of 0.5%, or $14.6 million, compared to the FY 17 enacted level, $2.3 billion in user fees, an increase of 12%, or $268.7 million, compared to the FY 2016 enacted level, and $75 million in new mandatory funding to support the White House Moonshot to Cure Cancer initiative. The biggest area of increase, as it was in 2016, is in food safety, specifically continued support to implementing the Food Safety Modernization Act, or FSMA. The FY 2017 budget requests an increase of $211.6 million above the FY 2016 enacted. This includes an increase of 1%, or $18.4 million in budget authority compared to FY 2016, and an increase of $193.2 million in user fees compared to the FY 2016 enacted. Within the overall food safety budget, there will be $25.3 million in new funds to improve food and feed safety through the continued implementation of FSMA. Congress enacted FSMA to recognize the very significant changes that have occurred over the years in the food supply, including its globalization and the changing nature of foodborne disease threats themselves. FSMA quite simply and fundamentally transforms our approach to food safety from a reactive system to one that recognizes that foodborne illness can and should be prevented, and implements the necessary steps to accomplish that goal, regardless of where the food is grown or produced. Last year saw the finalization of 5 of the 7 foundational rules for FSMA after several years of work by FDA and input from many, many stakeholders, and the last 2 rules are set to become final in March and May of this year. Now that the rules are final, this is a make-or-break year for FSMA. Now the rubber hits the road. Without full funding, FDA will be unable to complete putting in place the necessary programs, standards, and oversight that will bring FSMA from a concept to reality and allow American consumers and industry to begin to reap the benefits that it was designed to accomplish. The additional funding will help implement the produce safety rule and provide states with the resources to help farmers prepare for it, support our enforcement efforts, and further implement the Foreign Supplier Verification Program, which helps assure an even playing field for domestic and foreign products. In the area of medical product safety and innovation, this year's request represents an increase of $116.2 million above FY 2016 enacted. We're requesting an increase of 0.2%, or $3.2 million in budget authority compared to FY 2016, and an increase of 3%, or $38 million in user fees compared to FY 2016. In addition, there's the $75 million that was previously mentioned in new mandatory funding for the Cancer Moonshot. Our focus is on 5 priorities: leveraging real-world data on medical devices through the National Medical Device Evaluation System, continuing to support the President's Precision Medicine Initiative, improving the safety of compounded drugs, combating antibiotic-resistant bacteria, supporting animal drug and medical device review, and harnessing the power of innovation to bring a new generation of cancer diagnostics and treatments to market. Let me just end my opening statement by once again sincerely thanking the subcommittee on behalf of our entire workforce for your support, your advice, and your assistance over the last year. I can only say that it's been especially helpful to me. This job is a tough one, as you mentioned, and has a share of challenges, but it is without question one of the most rewarding opportunities that I've ever had in my long public health career. Especially gratifying is the knowledge that our actions and the decisions that we've made help people across the country each and every day, and in the end, that's what makes it worthwhile. I want to thank you for allowing me to be here today to discuss this year's budget and how it helps FDA meet its public health responsibilities. Coming at a time of enormous change, this budget is a modest request to help us meet the challenges of globalization, embrace groundbreaking and potentially life-saving scientific and technological advances, and continue to provide American consumers and patients with the confidence in the people that work to protect and promote their public health. So with that, I'll end my statement, and I look forward to being able to answer your questions.
Thank you, Dr. Ostroff, for your testimony. On a lighter note, before we get into the some of the issues, I was just going to mention, you mentioned about the transition between you and the new Commissioner, Dr. Califf, who has been confirmed. When does that transition actually take place officially?
The official time and day has not yet been established.
Okay, that's what I wondered, if it had time had been set. So, but regardless, as I said in my earlier testimony, we're in good hands either way. So
well,
we look forward to working with him. But certainly we have enjoyed working with you, and as you continue in this role, we know you'll do a tremendous job.
I'm not leaving.
So good. What I wanted to add, my first question deals with the GMO safety and labeling. When Secretary Vilsack testified in front of this subcommittee 2 weeks ago, we touched upon two critical issues relating to GMO foods. As background, Secretary Vilsack recently brought the two major sides together, those for mandatory labeling and those that are against mandatory labeling. And his attempt was to try to forge a compromise on the matter. Over the past few years, each side has shown great passion, as I'm sure you all know, about their positions. In the current state of things, the GMO labeling debate has created much confusion on the part of consumers. My question would be, and just to the bottom line, does FDA believe that GMO products are safe for consumers?
Thank you for that question, and I would totally agree with you that this is a very complicated issue. There's a great deal of passion on both sides of this debate, and certainly FDA has a very important role in this area. We have assessed from a scientific perspective genetically engineered foods, and as we have looked at these foods, we have, from a scientific perspective, we have not seen differences in the food items in comparison to those which have not used genetically engineered production methods. And so as a result of that, and again, our criteria for issues related to labeling have to do with being able to provide the consumer material facts that are important from the perspective of their health. And so we are very supportive of a voluntary approach to labeling, and as we put out in the guidance that we put out in November of 2015.
Can you give us some reasons why FDA decided not to mandate labeling in the agency's decision to approve the GE salmon?
So again, our perspective is that we believe that it's very important that consumers have information about the material that's actually in the foods themselves, rather than the methods in which those foods are produced. And so that's been a very consistent position that we've had now for many, many years as it relates to whether something is genetically engineered, whether it's produced by free range or other types of, that's a method of production rather than a material fact regarding the material that's actually in the product. And so that's been the basis for us to determine that while we believe that it is very important for consumers to have information, that it does not represent a material fact.
Vermont's law goes into effect in July, is my understanding, and apparently Secretary Vilsack was quoted yesterday as saying that it will, quote, create chaotic circumstances, unquote, for the food and agriculture industry. As the lead agency for the labeling of 80% of the food supply, can FDA support preemption of menu labeling and not preemption for GMO labeling, especially if we end up with a patchwork of laws covering GMOs?
So thank you for that question. We've not taken a position on those particular laws.
What would be the implications for consumers and the farmers and the food manufacturers out there with this?
Well, again, we can only look at it from the perspective of the guidance that we've previously issued in November of 2015. And again, we feel that the appropriate approach in that guidance, which is voluntary labeling, and it's voluntary labeling whether there is genetically engineered material in a particular product, as well as whether or not there is no genetically engineered material in a product, is a very reasonable way to go.
Well, regarding GMO products, I understand the information is important to consumers, and that is, certainly respect that. But if GMO products are safe, then my question would be, why is not FDA or even sister agencies doing more to educate the consumers and to educate consumers that these products are perfectly safe? And I am concerned, and I think many are concerned, that some in the administration has not done enough to get in front of this debate and really use the influence that you have and the information that you have to ensure the public there is nothing to fear about GMO products, which, as you know and you have said, have been deemed safe for decades. So I would hope that would be something that the agencies and sister agencies could be more engaged with, and to assure the public of this.
Yeah, well, I think one other thing just to mention is, the guidance that was put out in November of 2015 was draft guidance, and obviously there were many comments that have come in, and we continue to review those comments, and certainly we will take that information into consideration as we work for the guidance to be finalized.
Yeah, well, takeaway, like I said, we would just encourage you to try to communicate that so the public will have an assurance that there's no safety concerns with GMOs. So, Mr. Farr.
Thank you, Mr. Chairman, and I appreciate that line of questioning. I think this is something where we've all kind of, and the industry, as Secretary Vilsack said, ought to be taking the lead in this. But what I don't understand in your answer to his question is that you're protecting the label for sort of medical facts, but then you're going to allow it to be voluntarily adjusted. I mean, why? How's that protecting the label?
Well, again, there are certain facts that we feel are necessary to inform consumers of the content of the actual product itself. There are many additional pieces of information that could be included in the product labeling that would not be required to be present, but on a voluntary basis to provide additional information to consumers, we would have no problem with that.
Well, what's that like? I guess that would be like the milk cartons that say that these cows are not treated with whatever. Yeah, that's voluntary among the industry, right?
Correct. I mean, it's the same.
It doesn't speak to the health of the milk.
Right. It's the same concept, which is that it has to do with production methods and not the content of the product itself.
Well, Mr. Chairman, I hope sometime we just have a separate hearing on this, because I know states, and California included, is going to do statewide initiatives on this, and I think it is going to create, and we are, I mean, this is the crown jewel of labeling is the FDA, and if, you know, if this is going to be in a whole new initiative that everybody decides, each state, about how they're going to label products in their state, I think it's going to create tremendous confusion and lose confidence of the consumer. Anyway, I wanted to get back to my original comment about, I think your agency's been asked to do a lot and given very little resources to do it. And I wondered if you're maybe given too big of a mission and too small of a budget. Can you tell me what are some of the tasks that might get short shift because of a lack of adequate funding? Can you name one or two programs where you wish you had more funds to do a better job?
Well, what I'll say, Congressman, is that we are very supportive of the FY 2017 budget request, and we believe that the request from the administration will allow us to continue the work that we've done, especially in areas that we've been especially successful, while in certain areas that are our greatest priorities, being able to, in very targeted fashion, apply additional resources. So again, within the budget, our priority requests are in the areas of being able to continue to implement the Food Safety Modernization Act. As I mentioned, that this for us is really a very critical time period, and that we are moving from from developing the rules and regulations into implementation. Well, and so there are great expectations.
I really appreciate it, because Congresswoman Pingree and myself are very involved in specialty crops, which are essentially fresh vegetables. Yeah. And my district is known as the salad bowl capital of the world, and we grow something like 70% of all the lettuce in the United States. There's no kill step in that. There's no, you don't cook lettuce. So the food safety requirements that these farmers have adopted in specialty foods are really keen. I mean, California invented this with a leafy green marketing order. What we're concerned about now is that there's going to be a new set of regulations and a whole bunch of bureaucracy that farmers are going to have to fill out in order to meet the federal standards. You talked about having enough money to implement the program and to prepare the farmers. Is it going to require, though, that they have to, are you going to put these money in the states and really make sure that this is integrated with what's going on in the states, so we don't have to have another bunch of paperwork and information?
The short answer is yes. We have, one of the major tenets of our development of the regulations related to the Food Safety Modernization Act is this concept of the integrated food safety system. The integrated food safety system means partnerships at the federal level, at the state level, and at the local level, and in addition, partnerships with industry and partnerships with all of the other stakeholders that have a role in assuring food safety. And so we've developed these regulations with a great deal of discussion with our state counterparts. We fully expect...
So, for example, in California, which already has a program in place, would you just absorb that as being adequate?
So, the rules that were developed for FSMA were done in a collaborative fashion with the states to assure that there is no duplication of efforts. In addition to that, a very critical component of what we're doing with the resources that we have obtained, particularly the 2016 resources, and of course part of the request for 2017, is to make sure that we can provide support to all of the states to be the frontline interface with the farmers and with the other small producers that are a critical part of the food safety system. And so we don't look at this as being duplicative at all. The
Will it
produce-
cost them any more money?
When you say will it cost them, are you talking the states or are you talking
Yes,
the
states
farmers
and local
themselves?
farmers have to pay more,
Well,
like inspection fees for restaurants and things like that.
well, you know, to a certain degree, it depends on where an individual producer happens to be. Very often, virtually everything that is being required under FSMA, many of the farmers, particularly in your area, have a tremendous head start in implementing many of the things that are in FSMA, and so they shouldn't be particularly impacted by much of what's particularly in the produce safety rule.
Thank you.
Yeah, Dr. Harris.
Thank you very much, and good to see you again. I have a couple of issues, and maybe we'll get to some others in a second round. But I had a visit from some of the scientists up at Johns Hopkins who work in, the two pathologists work in one of the laboratories, and they're very concerned about the laboratory-developed tests regulation. And they made a fairly cogent case to me that you know, they're already regulated. Most laboratories are regulated by HHS under CMS under CLIA, and that this is what the FDA is about to bite off is probably a whole lot more than it can chew, because there are, by their estimate, there could be more than 50,000 laboratory-developed tests out there, and as you know, they'd mostly have to be treated uniquely. That's just a whole lot. So can you just explain to me why the CLIA mechanism for regulation just won't do for these laboratory-regulated tests, and why you think a second level of regulation won't impede the access of patients, especially in oncology treatment, to sometimes life-saving therapies?
Thanks for that question. This is an area that I've actually spent a great deal of time looking at over the last few years, not only while I've been the acting commissioner, but also in my previous role as the chief scientist. I think that there are a couple of things to point out. One of them is that FDA has always had the regulatory authority to regulate laboratory-developed tests. However, since the 1970s, we have always used enforcement discretion in this area. But I think one of the things that's really important to point out is that, like so many of the areas that we regulate, there have been very significant changes in the area of laboratory-developed tests from 1976 to the present. It has grown considerably. The complexity of the tests that are being done have grown considerably. And in some instances, and we published a report last fall where we detailed circumstances where there are significant problems with the quality of laboratory-developed tests, particularly laboratory-developed tests in circumstances where specimens are coming in from all over the country. It's a very different paradigm than the paradigm that in general has grown up in laboratory-developed tests, where these were tests that were performed in one laboratory for use directly in the institution in which the laboratory was affiliated, and there's a very substantial change. And you know, from the standpoint of the patient themselves, they're not aware of whether or not something is being run as a laboratory-developed test or whether or not it's a commercially available test that's been assessed by FDA for the diagnostic accuracy and the clinical validity of that readout. And so that's part of the reason that we have embarked on this pathway to bring laboratory-developed tests under our review. And however, we've embarked upon this in a very cautious way. We did put out draft guidance approximately a year and a half ago, and as you might imagine, we've gotten a great deal of comments.
Oh, I got those comments yesterday. I got an earful, and I'll have other questions, so I'll just leave it at there's great
but the other
concern
thing
with
that I
me
will
about
say,
this.
you know, regarding the role of CLIA, We are in close partnership with CMS that oversees CLIA, and I guess the way that I would describe it is that our role has to do with the quality of the test itself, and CLIA is largely devoted to the systems that are in place to actually run the test, rather than assessing the quality and the interpretation of that test. And so we view our role and CLIA's role as being complementary. There have been hearings in which CMS has testified and indicated that they don't feel that they have the necessary technical expertise to actually be able to review the test itself for diagnostic accuracy.
I'm just going to have to interrupt again. My time is running out, and but I'll get around to in the second round. That's true. They don't, but all these tests, if you can correct me if I'm wrong, they're all ordered by physicians or advanced health professionals. Is that right? So they're ordered by someone. Sure.
Yeah.
So actually ordered by someone who might actually have the training and the certification and documentation and degrees and all the rest to be able to make that decision. And now what I see is FDA stepping in and making what traditionally has almost been a practice of medicine decision. I really do feel that way. I think that this is too bad, because as we embark on a new cancer initiative, we're about to throw a huge regulatory roadblock, and not all laboratory developed tests deal with cancer, but a large number of the complex ones do. We're about to throw a huge regulatory roadblock in the way. I yield back.
All right, Ms. Pingree.
Thank you very much, Mr. Chair. Thank you for being here today and for the work that you've been doing, and I know you'll continue to do in spite of the changes going on, and we'll look forward to working with the new leader of the organization. But I want to follow up a little bit on what the ranking member said, and I have another question. So I'll just give you all my thoughts and won't let you answer them. So we can follow up in writing. But just on the FSMA rules, and I appreciate the ranking member bringing up many of the concerns that people have. And, we've worked very closely with you, and we appreciate Mr. Taylor coming to Maine. And I know you've really focused over the last few years on some of the impacts that it's going to have with farmers who will be newly introduced to this. And Mr. Farr talked about the fact that, some of the farmers that he works with are very large scale. They've already implemented many of these safety procedures. But in my region of the country, we're going to have a lot of new farmers affected by it. So just a couple of things. I want to say that I hope that in terms of this National Integrated Food Safety System, that stakeholders will have a chance to provide some input on the plans. And at some point, I'd just like to see a record, a timeline for the record that sort of tells us, what the overview of that will be and how it will be implemented. And secondly, I know you're thinking about, and there's some increases in the budget about how the training process will be, but you can imagine there's tremendous confusion and great concerns about that. This is going to be a big challenge, particularly small and medium-sized farmers who haven't been experienced in this procedure before, and a lot of confusion about who qualifies and who's required to do what. And so the amount of training money available out there, particularly going to the states, and we've heard from the National Association of State Departments in Agriculture that there isn't sufficient funding. So again, I know there's increased funding, and I know you're thinking about directing a lot of it to the states, but I just want to reiterate that that is one of the continuing concerns. And as we get into the implementation phase, the last thing we want to have happen is we care deeply about food safety, of course, and that's been a big mission of Congress to move forward on that. But on the reverse of it, we don't want it to be this cumbersome bureaucracy that farmers can't figure out, or that frankly, reduces some of the ability of farmers who have moved into new markets and are really having great success with direct-to-consumer and farmers markets and a whole variety of new marketing techniques around the country in everyone's district. So we don't want to see that getting in the way. So I'm just going to throw that out there. The real question I want to get to, because I know we'll have a chance to follow up on that, is an issue that concerns everyone on this committee, and I just came from another hearing on this topic, and that's the opioid crisis, and I know you're very engaged in that and, working on plans to deal with it. And we've been appreciative of reading some of the things that the department is doing. Obviously, the president's making an important initiative, and I'm sure there's not a state here that hasn't got their own long list of stories about what a challenge this is. And I just want to talk about one little part of it. And thinking about what the FDA can do to improve prescribing practices, expanding risk evaluation and mitigation strategy requirements for the immediate release of opioids. And I know that the department has called the development of non-pharmacological approaches to pain an urgent priority. So I just want to hear, do you think that there's a lack of safe and effective alternative treatments for chronic pain? And if so, can you elaborate on some of the efforts underway in collaboration with the NIH and industry stakeholders to fill that need? And would the FDA consider emphasizing non-pharmacological treatment options in the continuing medical education component of the risk evaluation and mitigation strategy? It just seems like that's a good opportunity here available to us.
Those are a lot of points that you
It's a lot to
raised.
answer in a minute, I know.
What I'm going to try to do, at least let me just touch upon the first issue that you raised, because one of the ways that we have developed and one of the sort of the central points of FSMA is to educate while we regulate. And I think that that's very important. In other venues, we've also said educate first and regulate second. But they actually do go hand in hand. And so we're in full agreement with you that it's really, really critical that we be able to develop the necessary educational programs down to the farm level and also for the small producers so that they have a full understanding of what they're supposed to do, because it's much more important that we come there and be able to say, you know, you're doing it right, rather than to come there and say, uh-oh, you didn't do it right.
Absolutely.
And so we think that that would be a win-win for virtually everybody, and it has been from the very beginning one of our priorities. In the area of opioids, I think that you mentioned a number of things. We have taken all of those issues into consideration. We, you know, if you were to distill the action plan that we put out a few weeks ago, I would put it into 3 different areas. One of them is to reduce abuse. The second one is to save lives. And the third one is to facilitate treatment and recovery. And so that action plan contains items in each of those areas. Obviously, one of the ways to reduce abuse is to minimize the use of opioids when it's not necessary to use them. And obviously, we've worked very collaboratively with our colleagues at the Centers for Disease Control and Prevention in their opioid prescribing guidelines. You may know I worked there for a long time, so I know these folks quite well. And there is a very critical role for being able to use other approaches for pain management that don't necessarily involve the use of opioids. They shouldn't be necessarily the first thing that you turn to, and there is a very important research need to be able to develop more alternatives to opioids that would be able to address the needs of patients who are.
Thank you. I've gone over my time, but I appreciate the
Mr. Rooney.
indulgence.
Thank you, Mr. Chairman. I think one of the things you could start with, or one of the agencies could start with, is this fall my son broke his nose playing football, and we went to the emergency room to have it reset. And as we left, they gave us a prescription for Percocet. He's 13.
It's really unfortunate. We hear that a lot.
Yeah, I mean, it's like I didn't have that when I got hurt playing football when I was younger. It was, you know, take some Advil and suck it up. But anyway, I was shocked. I was shocked. But I'm just switch subjects if I could and talk about tobacco. I want to talk about the deeming regulations and the proposed rule to deem e-cigarettes and cigars under the jurisdiction of the Center for Tobacco Products. The FDA estimates a number of pre-market tobacco applications and that the FDA expects to receive as 27, one for cigars and pipes and the rest for the remaining 25 for vapor products. Congress statutorily, as you know, mandated that the tobacco industry, including cigar manufacturers and importers, pay a user fee to fund the Center for Tobacco Products. Each entity's share was determined by how much each paid into that tobacco buyout. Did you consult with the USDA about the number of cigar manufacturers and importers that participated in that tobacco buyout to determine the number of applications the FDA would receive annually? And did you consult with the Alcohol and Tobacco Tax and Trade Bureau over how many cigar companies would have registered with them?
If you might indulge me, Mitch Zeller, who runs the Center for Tobacco Products, is just behind me, and since he was very heavily involved in the development of the proposed deeming rule at the time that I wasn't, I'll let him at least answer that particular.
Thank you.
My name is Mitch Zeller. I'm Director of the Center for
Hold on just a second. We need to just to get unanimous consent to allow
Sorry.
the testimony. Is that any objection? Proceed on.
My name is Mitch Zeller, and I am Director of the Center for Tobacco Products at FDA. Consultation with USDA, in addition to a number of other sources of input, went into the calculations that were in the proposed rule. I would say in response to the proposed rule, we've received a number of comments from industry and others on that, and unfortunately I can't talk about what's in the final rule, but we received a lot of comment on the numbers. The numbers in the proposed rule were our best assessment at the time. We've taken all of the comments into consideration that we received on this, and when the final rule publishes, you'll be able to see revised numbers, principally based upon the input that we received as the system is supposed to work through the comment and rulemaking process.
Okay. I don't know if this next go ahead.
No.
I don't know if this is also for you, but industry analysts and trackers estimate the sale of e-cigarettes in 2015 were more than $3 billion, and vapor shops sell more SKUs than obviously we can probably count. And in the 9 years since the February 15, 2007 existing predicate date, tens of thousands of cigars have been introduced to the market. Given that information, do you think the regulation put out to deem electronic cigarettes and tobacco products underestimates the number of pre-market tobacco applications that manufacturers will have to file?
So again, there were numbers that were included in the proposed deeming rule. As you're probably aware, we received an extraordinary number of comments based on the proposed rule, more than 135,000 comments that we had to go through as we work towards finalizing the deeming rule. And so, I can't discuss what might be in the final version of this, but we've taken all those comments into consideration.
Okay. Thank you, Mr. Chairman. You're back.
Mr. Bishop.
Thank you very much, Mr. Chairman. I apologize for my delinquence. I had another hearing going on at the same time, and I was required to stay there until its completion. Let me welcome the witnesses this morning, and let me delve right into FDA security of food records. Some members of Congress have expressed concerns about whether FDA has taken adequate measures to protect additional trade secrets and confidential information entrusted to the agency as part of its regulatory activities under FSMA. In particular, in August of 2015, the House Committee on Energy and Commerce investigated FDA's security of food industry trade secrets and confidential information. The report notes that FSMA expanded FDA access to company records involving sensitive business information of regulated entities in the food industry, and it questioned FDA's ability to protect that information. In February of this year, the committee leadership sent a letter to FDA asking for information to allow the committee to determine whether FDA has taken adequate measures to protect additional trade secrets and confidential information entrusted to FDA. Can you describe what actions FDA has taken to respond to these concerns?
What I can say is that I do recall seeing that particular letter, and we're in the process of developing a response to that letter. It is an issue that we take quite seriously, probably what would be best is if we develop the response to that letter and provide the information back to you in greater detail.
Thank you. Thank you very much. Look forward to that. Our state agriculture officials and representatives of the National Association of State Departments of Agriculture have continued to push for full FSMA funding so that frontline state officials can prepare for implementation. NASDA further supports the administration's request for an additional $25.3 million in budget authority for FDA food safety and FSMA implementation for FY17. Can you describe how FDA's federal staff work with your state partners on the ground to ensure that states have adequate technical support and the resources to implement the various regulations under FSMA? And what type of support is provided to the state public health and agricultural agencies to implement FSMA's requirements? And what is the level of financial and technical resources that is provided to states?
Yeah, thank you for that question. So as I mentioned before, we have worked very, very closely with our state counterparts, not only in developing the rules and regulations, but also in assuring that as part of the integrated food safety system, that there are appropriate resources to be able to meet the requirements of these regulations, including working very closely with our partners in state departments of agriculture. There have been funds, including funds in FY16, and part of the request in FY17 are prioritized for being able to provide support to all of our state partners so that they can fulfill the expectations as part of that integrated food safety system for the role that they have, particularly working with the produce, the farms that are producing fruits and vegetables around the country, and also the small producers. And so we do know that that's a priority. In the funding that we received in FY16, $19 million of that funding is specifically to go for support to the states. And in the request that we have in 2017, an additional proportion of the $25.3 million, and I believe the figure is just over $11 million, is also for funding to go to the states.
Thank you. Let me talk about the Cancer Moonshot Initiative. February 1st, the White House launched the National Cancer Moonshot Initiative, and according to the FY President budget request, FDA is requesting $75 million in mandatory resources, a direct transfer. As part of the initiative, FDA will establish a virtual Oncology Center of Excellence to streamline collaboration across FDA's human drugs, biologics and devices, and radiological health programs. There's also mention on collaboration with NIH. Can you explain the collaboration between NIH and FDA, and what are the expected deliverables in FY16 from what resources?
So again, the Cancer Moonshot funding is for FY 2017, and then it's for a 5-year period. However, having said that, we have a very close working relationship with NIH. As you can imagine, even the development of the moonshot itself in collaboration with the administration, and in particular the Vice President's office, was very, very close. If you think about what's necessary for successful medical product development, what you have is you have the phase of discovery, you have the phase of translating those discoveries into medical products, and then you have the very critical role of FDA, which is bringing those medical products through the approval process so that they can then be used by patients. All of them are critical, and they have to be done hand in glove. And so, with all of the discovery work, which is being done by NIH and NCI, we've worked very closely with them in developing this particular proposal. As far as the Virtual Center of Excellence is concerned, it's a very important concept, because one of the main objectives of the moonshot itself is to be able to break down barriers between investigators, not only in terms of the way the clinical trials are done and doing large-scale clinical trials across multiple institutions, and in addition to that, being able to share data. And being able to enhance patient enrollment into the various clinical trials. And just as breaking down those types of barriers that have inhibited some of the work, we need to break down the internal barriers within the FDA. And, you know, we have work that goes on medical devices, we have work that goes on within biologics, we have work that goes on within pharmaceuticals, and this is an opportunity to bring together all of the individuals across the agency that are working on cancer-related activities, whether it's the diagnostics or whether it's the therapeutics, and make sure that they're all working in the same direction.
Well, I commend you for that, and as a cancer survivor, I certainly appreciate the elimination of the proposed elimination of all of the silos that have slowed down the collaboration. So I wish you the best in that, and anything we can do to be helpful, please let us know.
Thank you very much.
Thank you, Mr. Chairman. Commissioner, great to have you back before the committee. We appreciate you sort of being a pinch hitter to step in and be the acting director, and you've done a good job. You've been easy to work with and responsive, and I appreciate that and commend you on your service.
Well, thank you very much.
I want to associate my comments with some of the comments my colleagues made. First, from Mr. Bishop in highlighting the important role the FDA plays as it relates to NIH. We've discussed before, and the moonshot, and certainly 21st Century Cures, which I believe had $500 million to support the collaboration and moving these products through the FDA so that we can realize the goals of the NIH. And so without the FDA, the NIH doesn't really ultimately get its drugs to market. And so thank you for your work there, and you're making that part of your mission. I want to associate my comments with Mr. Bishop's comments. I also want to associate myself with Dr. Harris's comments relating to LDTs and the concerns he raised, and I think he's raised some very legitimate concerns, and I look forward to working with FDA and the Energy and Commerce Committee, which is working on this as well, to ensure that we're not over-regulating those. And then I also want to associate myself with the comments of Mr. Rooney, and I wanted to maybe follow up where he had left off regarding the predicate date, the February 15, 2007 predicate date. You know how important this predicate date is to Americans, because it delineates the two pathways that tobacco products or tobacco derived from nicotine derived from tobacco, how those products can come to market. It's a critical day, and a lot of members of Congress, based upon the questions Mr. Rooney was asking you, believe that the predicate date should be moved forward, and that it's too early in terms of 2007, that we need a new date. And so I just want to talk to you a little bit about vapor products in particular and how they are impacted by this. You know, there's virtually no ability to find an appropriate predicate date prior to February 2007 for vapor products. It just didn't exist on the market at that point. So essentially, you have substantially, your agency substantially equivalence pathway to market forever for this entire class of product is eliminated. There's no substantial equivalence allowed. It seems backwards, I think, that the FDA would have a higher bar for a product that many in the public health, including the government, United Kingdom, which we've seen, believe is significantly less harmful than a conventional cigarette. Why we're putting a higher bar there doesn't really make a lot of sense. The proposed rule is written. Once the final rule is published, manufacturers will have 2 years to submit an application for the FDA for each product. But as Mr. Rooney highlighted, it's not just the branded name product, it's an application for each variant of the product, including flavor, nicotine content, size, FDA. So it's a pretty big burden. Not changing the predicate date would burden smaller manufacturers, jeopardizing many small businesses. It would take significant resources. Estimates range from 300,000 to 20 million to achieve the necessary requirements. If the higher estimates are correct, only corporations with significant assets and resources will be able to get their products through the application process. The proposed rule has a significant potential to decimate the emerging vapor market, as well as driving many small manufacturers out of business, causing a significant economic impact. Additionally, the regulatory burden on the Center for Tobacco Products will be enormous. As Mr. Rooney highlighted, the number of applications will inundate the center. It could potentially number in the tens of thousands, including both vapor products and cigars. This committee has witnessed the significant problems the Center for Tobacco Products has had with substantial equivalence applications in years past. And so I guess with all of that being discussed and the reasons outlined, I guess wouldn't it be better to move the predicate date forward for newly deemed products and specifically set standards for vapor products?
So there's a lot in your question, obviously. And let me just try to, you know, it's difficult to address all of those issues, but what I would like to sort of focus on is a couple of different areas. One of them is that everything is a very difficult balancing act, as you know. One of the major concerns and one of the, you know, the legislation that established the Center for Tobacco Products was particularly to reduce the harms of tobacco in youth. And so much of the work that gets done has to do with youth. And one of the major concerns with e-cigarettes, and there's been a lot of data that's been published, including from the CDC, showing that the rate of use of electronic cigarettes in our youth has tripled over the last couple of years, and now exceeds the use of other types of tobacco products, particularly cigarettes. And this is a tremendous concern to see that proportion of our youth initiating the use of e-cigarettes because of the potential public health consequences from that. And so that's been a very, very strong consideration as we developed the proposed rule. And obviously, as I mentioned previously, we have huge numbers of comments, and as you can imagine, those comments are on all sides of the issue, and so we've been very carefully considering those comments as we move towards the final rule. In terms of the backlog of substantial equivalence applications, I think it's important to note, and I know that we've had multiple discussions with Chairman Adderholt about this, this particular question. You know, the Center for Tobacco Products itself is only 6 years old, and so they were started from scratch and have significantly expanded based on the resources that are available under the Tobacco Control Act. And so they're in a considerably different place today than they were even 3 or 4 years ago. And at this point, in terms of the backlog of substantial equivalence application, by and large, these have been cleared up. 73% of all of the SE backlog that we previously had has been resolved as of December of 2015, and the vast majority of those that have not been resolved are products that are currently on the market. And so right now, for new applications that come into FDA, there is no backlog.
Well, I appreciate the efforts to try to clear that backlog. I think it will be ultimately greater than maybe we're estimating, and I would just say that having the predicate date in the 2000 year for these products essentially eliminates their ability to use the substantial equivalence route. And I just think that that doesn't really solve the issue with children using these, and we would be better, I think, working together to specifically set standards for these vapor products, and moving that date forward would achieve your mission, which I share, which is setting standards here to ensure that these aren't getting in the hands of children without totally eliminating the product from consideration, because they didn't exist before 2007. So I hope in your comments, you'll take that into consideration again.
Thanks very much.
Thanks.
Mr. Palazzo.
Thank you, Mr. Chairman. Dr. Ostroff, thank you for being here today. The number of U.S. rejections of imported shrimp has skyrocketed, and in 2015 we saw the highest level in history of refusals due to banned antibiotics. Foreign organizations and producers of shrimp readily acknowledge the use of banned antibiotics and other chemicals in their ponds. For example, the Vietnamese Association of Seafood Exporters and Producers has issued statements warning its members that continued use of banned antibiotics will result in products being banned from entry into the European Union. So my question is, in light of these record number of shrimp rejections and the ample evidence of widespread use of banned chemicals in foreign shrimp production, why has the FDA not instituted a product-specific alert to ensure that all imported shrimp is free of banned chemicals and antibiotics?
Well, as you can imagine, this supply is quite diverse in terms of the locations that these come from. And so, we have a system in place where we evaluate every single import line that comes into the country, and we use a risk-based approach to actually do inspection, do institute import alerts. And so that's a very critical tool that we use when we do find problems that exist. The idea of doing a wider import alert, would depend on the information that's available. But, as I said, we have seafood safety is a very big priority of ours, and we work very closely through the seafood HACCP, which is a critical component of this, to work with the overseas producers of these products to assure that they understand what's required and that there is compliance with the seafood HACCP requirements.
Well, I personally don't know who would want to buy shrimp abroad, but, America has the best shrimp, and the Gulf of Mexico has even the better shrimp. I'll just put that there, and I represent a district on the Gulf of Mexico, in full disclosure. All right, I'd like to discuss your agency's ongoing health review of rice and the possible risk associated with rice consumption. Can you give me a status update on this?
So this is an issue that we have devoted a lot of time and attention to. I actually started at FDA 2.5 years ago in the role of the Chief Medical Officer on the food side of FDA, and so we were in the process of developing a risk assessment on the issue of arsenic in rice. It's a very complicated issue. We've been working with a number of stakeholders inside and outside of government to be able to finalize that risk assessment and the associated risk management plan.
Does that include domestic rice farmers? I mean, as the stakeholders?
Oh, yes.
I mean, you're working with them?
We've actually visited rice farmers in a number of different states to be able to get firsthand input from them. No question about that.
Kind of where are we at with that? Is it still a review process going on?
Yes, it is definitely still in the review process. I can tell you that it is a very high priority of mine, regardless of what role I happen to be in, that we finalize that risk assessment. It's an important thing to do.
Well, thank you, Dr. Ostroff. If you could, please keep my office informed.
Absolutely.
On it. Thank you.
Yeah. Finish.
I yield back.
Okay, at this time, I'd like to recognize the ranking member of the full Committee of Appropriations, Ms. Lowy.
I thank you very much, Mr. Chairman, and I apologize, but as you know, Chairman Rogers and I wish we had roller skates. There are about 3 or 4 hearings going on at the same time. But this hearing is so very important to me. I wanted to be sure that I was able to join you, and I thank you, Dr. Ostroff. Thank you, Jay Tyler. Thank you for being here today. I want to focus on the FDA's ability to regulate new tobacco products, including e-cigarettes. Now, according to the CDC and FDA, the use of e-cigarettes has tripled in just 1 year, between 2013 and 2014, and now exceeds youth use of regular cigarettes. You can tell by the tone of my voice I am horrified by this. Medical studies are clear that nicotine, which is a central ingredient in e-cigarettes, is highly addictive, and that nicotine exposure can harm the adolescent brain, cause cognitive impairment, attention deficits, and other health issues. The FDA should have the power and the resources to regulate tobacco products to make sure consumers are aware of the risks and that parents do not believe these products are safe for children to use. The funding level for tobacco review was set many years ago in the Family Smoking Prevention and Tobacco Control Act. I'm concerned that once the tobacco regulations are finalized, thousands of tobacco products will have to be reviewed, and that the FDA will struggle to regulate these projects quickly. First, when will you release the final deeming regulations? Would the budget request adequately provide the FDA with the funds necessary to regulate new tobacco products?
Thank you for your comments, and it's really terrific
As you can
to see
see, I feel rather strongly
And,
about it.
and you know, if you had been here a few minutes ago when I was having a discussion with Congressman Yoder, I actually used the same statistic that you just quoted.
And I just
which
want to
is,
say, one of these stores open in my neighborhood, and I walk by, and you see Tutti Frutti and every kind of cute name for these products, and I'll turn it back over to you.
Without question, one of the major impetuses, and I don't know if impetus or impeti is the correct term, of developing the deeming rule was specifically for the reason that you cited, which is the potential impact that this has in youth initiation of nicotine use and tobacco products. And so it's been a primary driver as we developed this proposed rule. And as you can imagine, there is a great diversity of opinion from all sides on this particular issue. We received a phenomenal number of comments on the proposed rule that came out previously. And working through those and working through all of the various very technical and difficult issues related to getting the deeming rule finalized has been a priority of mine ever since I took over as the acting commissioner. It was a priority for Dr. Hamburg, as you well know, and we are working as hard as we can to be able to get this rule to final. As far as are we prepared for the implementation of the deeming rule when it does go final, we have been working now, you know, we proposed this more than a year and a half ago.
May I ask you how long you've been working on this issue?
So the proposed rule came out in late 2014, and there were large numbers of comments, more than 135,000 comments that were received, and the proposed final rule has gone through interagency clearance and through the White House, and we have been working on trying to get all of the aspects of this finalized. I can't tell you when it will actually be finalized. All I can say to you is that we are as passionate as you are about being able to get this to final. We've been preparing for the workload that it will entail. The Center for Tobacco Products has been evaluating that. They are raring to go, and we hope that as soon as the rule gets final, we can get started.
I just want to say that I just find it shocking that these stores are opening up in all of our districts, and there's been no rule out there, and nobody publicly evaluating officially as to whether it's safe or not.
Well, that's one of the reasons to put the deeming rule out there and bring these under our regulatory purview as we have with other tobacco products, because once that occurs, then we will be in a much better position to understand what's actually in these products.
Well, thank you. And do I have time for another question? You're very kind. 8 major allergens are required to have a label displaying their inclusion on a list of ingredients on food packaging. This is an issue I worked on many years ago, and I'm very pleased about that. People with celiac disease, all kinds of allergies, are really grateful for the work that we all did together. Now, sesame is not one of them, even though sesame allergies are estimated to afflict nearly 500,000 Americans and growing, making it one of the 6 or 7 most common food allergens. And for consumers with a sesame allergy and parents of children with the allergy, sesame is particularly troublesome because of its derivative ingredients. That may not even mention sesame in the ingredients at all. And for these consumers, it's difficult to know what products they can purchase, what they cannot, which could lead to significant harm. The FDA does have the ability under the Food Allergen Labeling and Consumer Protection Act to add new ingredients to the list of major food allergens. Has the FDA considered adding sesame to the list of major food allergens?
So thank you for that question as well, and it's one that I'm aware of. It is our understanding that the law itself stipulates the major food allergens and that FDA itself cannot make changes to the list that's in that particular law. However, it does not mean that we do not have the regulatory authority to address other food allergens. Food allergens are a very important issue, particularly for consumers who need the information to know whether or not they should consume that particular product. It's obviously a material fact, and in some instances, the label itself may not contain or may not list sesame as the particular ingredient. It may simply be on there as spice or something like that. And so this is something that we are working on.
Can you tell me what we can expect and how long will it take? Now, I should just share with you, my colleague who's been here probably as long as I have, maybe a little longer, remembers that at one point we didn't have labels on food, and it took me 5 years. I could not get anybody on the other side of the aisle to sponsor the food labeling. Finally, Jim Greenwood, some of you may remember Jim Greenwood, joined me on it, and then it passed on a unanimous vote of the Congress, which made me very pleased. So I never knew about sesame at the time, or we would have worked to include that, and science continues to give us more information. So I just wondered, since people are really suffering, getting very ill as a result of this, give me an idea of what it would take, how long would it take to include sesame, and if you agree it should be considered one of the food allergens.
Well, again, we're assessing all of the available information so that we can develop a path
How long
forward.
have you been working on this?
It's certainly not a new issue, and so developing the necessary information to take the appropriate regulatory steps, as you can well imagine, takes some time. So I can't give you a very specific answer in terms of when our assessment may be completed and when we will move forward. One of the things to know, and thank you, Jay, for reminding me, is that we do have a citizens petition that's been submitted to us on this specific issue, and so we will have to develop a response to that citizens petition.
I wish you would get back to me and give me some approximate idea how long
We
it would
certainly
take, because I am particularly aware, having worked on these issues for a very long time, that this saves lives.
Yep.
And saves a great deal of suffering. Thank you, and thank you, Mr. Chairman.
Again, there's no question that food allergens present in the food supply is a material fact that the consumer needs to understand.
Thank you for your work.
Mr. Valadao.
Thank you, Chairman. Thank you, Dr. Ostroff, for making some time for us today. A couple comments were made here by Congressman Yoder and Rooney, and I want to associate myself with those comments along with the predicate date line of questioning, and something that I've also been following and very concerned with as well. So my first question, though, is the FDA has devoted significant resources in the past few years towards rulemaking to update the nutrition facts panel and related food labeling requirements. However, FDA's regulations about nutrient content claims for food haven't been updated since the early 1990s and are based on the dietary guidance and science that is now outdated. For example, foods such as pastries and pudding cups are now able to be labeled as healthy, while foods such as nuts, avocados, and salmon are not. I understand the FDA is currently considering a request to update the healthy nutrient content claim regulation and to reevaluate all its nutrient content claim regulations. Does the FDA intend to reevaluate the nutrient content claim regulations to ensure consistency with current federal dietary guidance? And understanding the rulemaking process takes years, what are the FDA's plans in the upcoming year to ensure that food producers can make truthful statements about the healthfulness of their products without fearing FDA enforcement based on outdated nutrient content claim regulations?
This could well be the shortest answer that I've given so far, and the answer is yes. And so, as you know, the new dietary guidelines were just recently issued, and we will be looking very closely at the content of the dietary guidelines as it pertains to the way products are labeled and the information that's available on those products, particularly around nutrient content claims. And so, without question, yes, we will be looking at that.
You found that yes way to make it a little bit longer, didn't you?
Yeah, yeah,
yeah. So no, that is obviously a big issue. My district farms quite a bit of
understand
nuts.
completely, yeah.
And this has a huge implication, obviously, on health. I mean, you look at people who are actually mindful of their eating habits
Yes.
and looking for salmon, looking for nuts, looking for avocados are all things that you would think are very healthy.
So,
And
so we think that those nutrient content claims ought to be in the context of the totality
you.
of the information that's in the label.
So as FDA contemplates recommendations to reduce sodium intake, I would like to emphasize the importance that all data and scientific research is considered before making decisions regarding sodium recommendations to the American public. The National Academy of Medicine identified sodium as just one of just 4 nutrients in need of dietary reference intake review. Additionally, the agency continues to expend resources on sodium reduction when it regularly reports that it lacks the funds needed to focus on issues Congress has asked for it to work on, such as implementing the Food Safety Modernization Act. Can you please comment on why the FDA continues to focus resources on sodium reduction while we have outdated DRI and the FDA lacks the funds to focus on issues that are currently under congressional mandate?
So what I will start by saying is that I'm a healthcare provider. I know Dr. Harris is also a healthcare provider, and we know that one of the most significant contributors to cardiovascular disease, other than tobacco, is the high levels of sodium in the American diet. And doing something about excess sodium consumption has the potential to significantly have a positive impact on cardiovascular disease in this country. There are estimates that the typical American consumes about 3,400 grams of sodium per day. That's far in excess of what the recommendations that are in the dietary guidelines and that others have recommended say that they should be, and we feel that rational, voluntary approaches, which I will say many in the industry are already embarked upon, is a very reasonable way to approach this problem in reducing the overall sodium content in the diet, because most of this is in products that the consumers don't really have an option of understanding what's there.
And then I think I've got time for just one more. As you know, FDA plans to pursue a cooperative agreement with the National Association of State Departments of Agriculture and State Agriculture Departments related to FSMA produce safety rule. FDA says this agreement will provide funding and support necessary to determine the current foundation of state law, the resources needed by states to implement the produce safety rule, as well as help develop a timeline for successful implementation. What are the details of the state cooperative agreement? Specifically, how will the FDA partner with states to enhance or enforce this partnership?
Thanks. You know, as I mentioned earlier, we consider the work that we do with the states in implementing all aspects of FSMA is really quite critical. They are a full partner in what we refer to as the integrated food safety system, and one of our priorities is to assure that we can get resources to all of the states for them to be in a better position to fulfill their part of the various rules in the Food Safety Modernization Act, most importantly as it relates to produce safety. And so in 2016, of the additional resources that we obtained for FSMA implementation, 19 million of that funding goes to the states, and in our request in fiscal year 17, a substantial amount of our request is for funding to the states.
Thank you. Thank you, Chairman.
Thank you very much, Mr. Chairman. My apologies to you, Dr. Ostroff, but Secretary Burwell was at Labor HHS. So let me just, I understand my colleague, Mr. Palazzo, addressed the issue or asked about the seafood and the explosion of seafood that will be coming from Vietnam and Malaysia. Let me just ask a quick question there because I want to move to a couple of other areas. My understanding is that we are going to cut off, and this is from the budget, FDA will not increase the number of foreign food facility inspections that it will conduct. Budget indicates that the percentage of port of entry inspections for imported food will drop. Do we have enough money? Do we have enough capacity to be able to deal with this issue? And I'm going to ask you for a quick answer because I want to get to Essure.
So I can tell you that among the rules, the foreign supplier verification is really a critical aspect of what we're doing with FSMA, because we need to assure that the safety of imported food is equivalent to the safety of food that's produced domestically. And so part of the funding that we received in 2016, as well as a large part of the request in 2017, is specifically devoted to be able to address import safety.
I want to make a point about FSMA, which I'm a strong supporter of, etc. The original, CBO's original score was for $583 million. We have funded, this is our responsibility, a total of $267 million. That is less than half. So therefore, all of the implementation of FSMA, in my view, is at risk. And that would include this inspection process that we're dealing with foreign imports. I'm going to leave it there, but you don't have the money. You don't have the money to deal with what FSMA asked us to do and to protect the food supply coming in, and that is going to increase substantially in tainted food coming from Vietnam and from Malaysia. Let me move to Essure, which is something I'm very concerned about. We have 5,000 adverse event reports filed by doctors and patients about this contraceptive device. I'm not going to go into all of the details. We have seen 4 adult deaths related to the device, 5 fetal deaths that occurred in women who became pregnant following the placement of Essure. Thousands of women have signed a citizen's petition to get Essure taken off the market. I wrote to you as well, asking for an investigation into this effort and asking that while the investigation is pending, that it come off the market in order to save lives. We put language into the 2016 Omnibus Appropriations Act that directs the FDA to issue recommendations on how to address concerns raised regarding Essure. The agency has to the end of this month to issue them. Are you going to issue them? And I'm going to ask the other question, are we going to take this product off the market and save women's lives?
So let me mention a couple of things. One of them is that part of our budget request in 2017 has to do with moving forward in something called the National Medical Device Evaluation System. And the reason that I think it's pertinent to this question is that that system, one of the major objectives of that system is to be able to do better monitoring than we currently do of products in the post-market setting. No question about it. And so that would help contribute to being able to address issues like this. The second thing that I will say is that we are very well aware of the language that's in the omnibus.
Sure.
As you know, we took this issue to an advisory committee last fall. We received a lot of feedback from the advisory committee. There were a large number of patients that participated in that discussion. We have taken that feedback. We indicated that we would be issuing a report on those findings by March 1st, and we intend to do so.
Well, but I'm asking you again. I don't know how much more monitoring needs to get done of a product that so far has killed 5 women and 4 fetal deaths. And the hundreds of thousands of women who have signed a petition talking about their specific incidents. And in the meantime, while we were going to take some of the 2017 money and look at monitoring, this product is there, and women are at risk. And I don't know how much more data we need. in order to be able to say, let's take it off the market until you collect more of your data. In the meantime, thereby trying to save people's lives and pain for women around the country. I strongly urge you to take this off the market until you are finished with an investigation. Don't tell me on March 1st that we're going to continue to study this effort to make sure that we have all of these various pieces in place while women are suffering out there in the hundreds of thousands, not 2, 3, 10, 12, 100, hundreds of thousands who signed the petition. Thank you, Mr. Chairman.
Mr. Young.
Thank you, Mr. Chairman. Doctor and Mr. Tyler, thank you for being with us here today. I just want a few updates on some issues here. As you know, the FDA is moving toward its menu labeling final rule coming up. And can you just talk about how that's going with stakeholders and where we are on that meeting with the industry and stakeholders? And also, you know, you're supposed to give some kind of educational and technical assistance as well when there's some issues that erupt in your meetings with stakeholders. And I hope that you are will allow in the end for a certain amount of the use of technology and innovations and allowing that to be involved here with the menu labeling. Because some of the thoughts that folks have, it could really put a mandate on some of these restaurateurs or grocery stores, and the technology and those innovations can be very helpful.
So, with, you know, you're specifically referring to menu labeling?
Yeah.
Yeah, so obviously this, you know, and I hate to be redundant, but everything is a high priority for us, and I wish that we, you know, could make progress further. Again, related to what's in the omnibus, we certainly understand the language that's in the omnibus that indicates that until the guidance is finalized regarding implementation of the menu labeling requirements, that they don't take effect either until December of this year or 12 months after that guidance is finalized. And so we've been working quite hard to get those, to get the guidance finalized so that we can start moving forward towards implementation. As part of finalizing the guidance, obviously we have had a lot of input from a variety of stakeholders, and we have been working with other stakeholders in terms of the implementation.
Give me an example of some of the stakeholders.
Well,
I mentioned grocery stores because a lot of grocery stores anymore have delis and they have restaurants within them.
yeah, so there are a fair number of stakeholders that have a role in this, and they range from, you know, the food marketers to the restaurants themselves and the various associations. We have talked with all of these individuals repeatedly.
Thank you. I want to talk about industry usage of the internet and social media platforms when it comes to the guidance for pharmaceutical advertising on the internet and social media platforms. Earlier this year, the FDA put out its guidance agenda for 2016, listing new and revised guidance. Give us an update on that. How is that going, and how is the FDA seeking a stakeholder input on this as well?
Well, as you know, any time that we issue guidance, it goes through a proposal, and we receive a variety of comments before we finalize any guidance that we put out, or in fact any regulations that we put out, and this would be no different than that. As far as the specifics of this, we would be happy to give you a further detailed briefing in terms of where that stands and the input that we received.
And I'm not going to spell out the acronym because it's too complicated, but we're talking about the social media advertising and promotional labeling of prescription drugs and medical devices.
Yes.
Okay.
And I won't say the acronym either.
Yes. Food safety training centers. Last week, the FDA announced a grant for Iowa State University to establish the North Central Regional Center for Food Safety Training, Education, Extension, Outreach, and Technical Assistance. Another one. To comply with the Food Safety Modernization Act requirements. Yep. Last year, the FDA estimated it was $276 million short of what is needed to roll out the FSMA guidelines and regulations. And this time around, the administration proposed another $18 million increase in the FY17 budget. I'm pleased the FDA selected Iowa State University. But can you talk about how funding for the FSMA could impact the goals and operations of not only this new center, but also the other centers as well?
So, the total request on the food side of the agency was in two areas. It was direct budget authority as well as the proposed user fees that have been put forward repeatedly in the last several years. And if you, and again, Congresswoman DeLauro mentioned this, that, the CBO had made an estimate of the total costs of FSMA implementation, and we ourselves had put together estimates of what it would take to fully implement FSMA. And those numbers we have looked at repeatedly. They're not that far off from the CBO, and if you put the number of the budget authority increases with the user fee increases, it would get us a substantial part of the way towards what we need to fully implement FSMA. As far as the training centers, they are a very important part of what we're doing with FSMA because, as I said earlier, being able to provide the technical assistance and the education that's required so that all of the stakeholders implement FSMA correctly, rather than us having to come after the fact and say you didn't do it quite right, is really very important. And so we have 4 centers of excellence in technical assistance. One of them is Iowa State, one of them is in Vermont at the University of Vermont, and the other 2, one is in Florida and the other is in Oregon.
Thank you. I have a few more questions. I'll wait till the next round. Thank you, Mr. Chairman.
Thank you, Mr. Young. During the FDA hearing 2 years ago, members on this panel had raised concerns about the potential negative impacts from an FDA proposed rule on label changes to generic drugs that had the potential to allow different warning labels in the marketplace at one time. Members also raised questions about the motive for this proposed rule after it was revealed that FDA met with a trial lawyer group prior to the FDA's issuing of the proposed regulation. The proposal, or this proposal that we're talking about, is against the backdrop of an environment, and I know you're well aware of it, that many in the public are concerned about the rising cost of prescription drugs. By some estimates, the proposed change would increase the cost of the generic pharmaceutical industry by as much as $4 billion annually. FDA, in spite of receiving more than 23,000 comments on the proposed rule, has never met with the industry representatives to discuss the rule, nor has the agency made any effort to provide a realistic estimate of how the rule would have an impact on prescription drug costs and access. My question, how can the administration tell the public they're concerned about rising cost of prescription drugs on one hand, and then the other finalize a rule that could add another $4 billion to the cost of prescription drugs?
So what I can say is that this is also an issue that I'm very well aware of, and it's a very complicated issue. What I can say without question is that our primary consideration is not related to litigation. It's related to being able to assure that the labels contain information that's important regarding the safety of products, whether it's the reference drug or whether it's the generic. And so this very complicated interplay between the licensed reference drug and the generic drugs and the safety information that's contained on them regarding adverse events is a really, really, really important issue, and it's a very complicated issue because of the way that the regulations and the statutes are written. And so we have been looking at this for an extended period of time, and as you know, there has been a fair amount of feedback that we've received, and we continue to work on trying to finalize this.
Well, I just want to point out the inconsistency, and because the cost of drugs is a very real concern, I think that the American public is concerned about, and then of course adding another $4 billion of cost would be something that would be inconsistent with the concerns. During Dr. Califf's confirmation hearing over on the Senate side, he was asked about the status of finalizing the labeling rule. in response to that question, he said that finalizing the rule was a top priority, and added that FDA needs to make sure that if there are problems with generic drugs that come up later, and they do with better surveillance system, that's a way of making sure the labels are up to date and consistent across similar products. I believe that the pending rule would require that the generic company that identified the adverse event to unilaterally change their drug label information prior to the review and approval of the FDA, but it would not require the remaining generic companies or brand to change their labeling, thus continuing to allow for a lack of consistency or a lack of sameness. In light of your desire to assure consistency and timely updates of information across similar products, why do you believe this proposed rule is necessary?
So this is part of the complexity. And part of the difficulty is that very often for many of these products, there's just not one generic. There are multiple generics. And so we do believe that it's very important to the degree that we possibly can that there is consistency across all of the various forms of a particular drug, because it may be that one manufacturer has access to information that the others don't, and there could be circumstances, for instance, where the reference product isn't even marketed anymore, and so the ability to move information back and forth between the reference manufacturer and the generics can be very challenging. And so getting this correct in a way that we have consistency in the information that's available across all of the generics for a particular product type is really important.
So when do you anticipate make final determination whether to move forward with this rule?
So I can't tell you exactly when we may get to that point, but it's something that we're working quite hard on.
Do you have any evidence or data to suggest that generic drug manufacturers are not compliant with the current reporting requirements?
I would have to get back to you. I am not aware of any.
Okay. Mr. Farr.
Thank you very much, Mr. Chairman. I also share that line of questioning on generic labeling. We're concerned about the cost increase to them. Every year this committee talks about the department doing sunscreen labeling, and nothing gets done. Here we are lauding the cancer moonshot, and yet with sunscreen cancer labeling we haven't gotten anything. It's gone on for years. What's the delay, and when are we going to get you to deal with it? Sunscreen labeling.
So thank you for that as well. This is again a very important issue, and it has to deal. It has to do with taking actions.
I know what it all is. Just do you have a date when you're going to get to it?
Well, as you know, we looked at all of the products that were submitted to us and determined in each instance that there wasn't information to make a final determination, and have set out a very clear course that the various manufacturers of these products have to use to be able to assure us of the safety of these products. These sunscreens, when they're used as they're supposed to be used, are repeatedly applied to large portions of the body, and we feel that it's really, really, really critical to be able to determine whether or not there is systemic absorption of these materials that might have long-term consequences, health consequences to individuals. We recognize that that's a very delicate balancing act in terms of prevention.
I know. I want a simple answer. I remember earlier when we were talking about GMOs, you said you don't pay much attention into the process. You want to know what the facts are. I think the questions we're asking is, the facts are, when are these dates going to happen? Is it going to be this year? Going to be something? I mean, is this going to be back here asking the same question again next year as we did
So I can say that, we've had, including myself, have had discussions with the various manufacturers about the pathway forward to be able to
I don't care about
accumulate the
process.
information.
Give me an answer of time.
Well, we've set out for the manufacturers what they need to do to provide the information to us so that we can make a determination.
And when will that be?
Well, the manufacturers have to get back to us.
Never mind. Compounding. With the additional funds that we gave you to assist in the oversight of the pharmacy compounding for both human and animal health, I'm concerned from the reports that I hear, and these are reports that are coming back to our office from patients, physicians, veterinarians, pharmacy groups, that the FDA is exceeding the authority granted by Congress in implementing the guidance for both human and animal drug compounding. The concern expressed is that these actions will unreasonably limit the patient and provider access to compounded medications and will result in the kind of legal challenges that Congress sought to prevent when it passed the Drug Quality and Security Act of 2013. Given the language we included in last year's budget agreement, what assurances can FDA give us, provide us, that these resources are being spent in a way that doesn't confuse the ability of pharmacists to compound human drugs versus veterinary drugs?
So, compounding is an area that we've devoted a lot of efforts to, and particularly developing all of the necessary guidance to implement DQSA. And the critical aspects of this is that compounding go forward in a way that is safe, especially as it relates to sterile products, and that's precisely what we're doing.
Dr. Ostroff, I have never had anybody in front of this committee that's better at talking bureaucracy and not getting... you always talk process. The questions here are sort of, everybody's been asking all day, sort of dates, times, when are we going to get decisions? And you talk about, well, we're doing stuff, but nothing the answer. So I don't know what assurances you're giving us, but let me go on to another question. Maybe I can get a straight answer. Congress required the FDA to promulgate and update regulations on medical gases by July 9th of this year. It's only 3.5 months away. Yet the FDA has not has even issued a proposed rule on the topic. I know that the FDA has issued guidance on the matter, but that guidance is not helpful to the industry because inspectors are relying on old regulations and ignoring the new guidance. When will FDA issue the regulation as the law is intended?
So this is something that I've also learned a lot about.
That's a when question, when?
This is well, we understand the deadline, and so. The requirements that were in FDASIA was to be able to assess the situation, to submit a report to Congress about things that we considered to be necessary, and it is our assessment that most of the changes that need to be done in the area of medical gases, and again, we've done this with a lot of discussion in industry, including last December, can be done through guidance. We did have a proposed rule that was issued in 2006, and one of our objectives is to be able to finalize that rule by the date, by the date that was established.
By July 9th. Yeah. All right, then I want to just follow up on Nita's question. Time's out, but this is just a when. When will the tobacco regulations get vaping under control?
So I can't give you a specific date as to when we may be able to get the final deeming rule out. We have been working very hard in finalizing that rule. I'm not able to give you a specific date. I certainly was hopeful that that rule would be final while I was still in the acting role. It's not, but we are working as hard as possible to be able to finalize it.
Thank you very much. And I'm sorry, like the gentlelady from Connecticut, I was next door with Secretary Burwell and missed some of the discussion about the trade secrets, but I just want to, associate myself with concern that we have to address making sure that trade secrets are protected when the FDA has access to them. Let me follow up a little bit about the sodium discussion the gentleman from California started. I was indicating my concern in meetings with you. It comes to my attention that the National Academy of Medicine has said that the DRI for sodium probably needs to be reviewed. I think it was last done in 2003 or early 2000s. It's been a while ago. Is that something that, do you know, for instance, what their time frame is to do their DRI review of sodium? Okay. Is that something that you'd take into consideration as the FDA considers where to go with sodium? I would hope that, you'd take wait to see what the DRI is.
Again, we will take all sources of information, including what's in the dietary guidelines, into consideration as we move forward with this. We think that the voluntary approach to reducing the overall amounts of sodium in the food supply is the right approach.
Okay. All right, and of course you realize, I think, and you realize as a physician, what we're probably going to find out a few years from now is that for some people it makes a difference, for some people it doesn't, and we have no idea which camp you're in right now, but I'm sure we'll know in a few years. With regards to the nutrition facts label, there's just some concern I have that adding the added sugars designation is probably going to I think it may confuse some people, because in my mind it's kind of the total sugars that really makes it. I mean, we really want to make sure the total sugar stays below a certain % of your diet, and that subdividing it may just add confusion. So my only question is kind of simple. I mean, I understand that there are studies that look at whether consumers how they process that information, and whether it actually helps them in decision making or not, whether it confuses them, because it does distract you from the discussion of total sugars in a product. Do you plan to do any consumer research to see how that, what the consumer understanding of the proposed added sugar addition to the nutrition facts label will do?
So we have done that sort of consumer research, and that has helped inform the direction that we feel we should go in with the nutrition facts label. And I understand what you're saying about the total sugar versus added sugar. And, it's not the same, because in general, when sugar is naturally present in many food items, it's present in association with many other important parts of the diet for proper balanced diet and health. Whereas added sugars are essentially empty calories, and they don't contribute to a balanced and healthy diet. And so we feel it's very important that there be a distinguishing between total sugars and added sugars, and that's been what the proposal was. And we've been working on what the best way is to present that to the consumer.
Good, good. Because again, I think there can be some confusion. Now, yes, I understand there may be some other benefits of foods that have sugars, but total sugar intake would be important. Finally, with regards to the predicate date for tobacco products and the whole idea of regulation, and as we talked about with some of the e-cigarette regulation, what I hope doesn't get lost is that for some people there is harm reduction when they switch to those products, and I remember one of the people on my staff, as I think I told you last year, I mean, this guy smoked a couple packs a day, and once he went to the e-cigarette, I mean, his use went way down, and I'm convinced that his risk is lower. Again, population-wide, I don't know, but we just shouldn't lose sight of the fact that there are some individuals in whom harm reduction occurs because of these products, so that as you go forward, to make it easier to market a new cigarette because of the predicate date than a new vaporization product, just is just one of those unintended consequences that you can come up with. So, and I thank you again, and thanks for being before the subcommittee. I yield back.
Thank you, Mr. Chair. I'm going to associate myself with a couple of my colleagues' remarks. Mr. Valadez gone now, but I do appreciate that he brought up some of the concerns. He mentioned nuts, avocado, salmon, and I know you said you're close on those guidelines, but because there's been so much rethinking about healthy fats, I just think it's important that that information is out there and that we catch up with the labeling, and what the public and nutritionists are already telling us. And then also with Congresswoman DeLauro and then Mr. Palazzo both mentioned some of the issues around imported shrimp and the challenges with potential contamination or issues. I do want to take issue a little bit with Mr. Palazzo, who suggested that the Gulf of Mexico has the tastiest shrimp. And very happy to have a challenge with Maine shrimp. This is our season right now, and they're pretty darn good, so we might want to just like have a little face-off over that. Yeah. I think a blind taste
I accept
test.
that challenge.
Okay, I think,
I
hate-
happily participate in the
Yeah,
taste
there you
test.
go. I kind of think I'm going to win, but I'm willing to let you into it, so. But I just want to have a little bit of a dialogue about antibiotic resistance with you, and I know that's a huge concern in the public health community, providers, and the administration has put some focus on it, and I'm just worried we're not doing enough, and we're not doing enough fast enough. So I know that the FDA published guidance in 2013 asking industry to remove the production claims for medically important antimicrobials, and I think that's good. And in 2015, there's veterinary feed directive final rule and guidance, again, good. And the FY17 budget request is $41.6 million for antimicrobial resistance activities, which is the same as FY16. So I'm a little concerned about whether FDA has the resources to ensure industry is compliant with veterinary feed directive and FDA's guidance on production claims for medically important microbials. So can you tell me what you're thinking, how much of your budget request will go towards the animal side of the FDA's antibiotic research? Do you have the resources to monitor compliance with the directive in the production claims? And if you don't have sufficient resources, then what is the impact on public health and safety?
Thank you for that question. So this is a very important year for us in terms of the activities related to the veterinary side of the antimicrobial resistance challenge, in that the 213 guidance that you referred to, which removes production indications for medically important antibiotics, actually takes effect at the end of this year. In addition to that, the veterinary feed directive rule went final in the fall of last year, and so they will both be in place as of the end of this year. And one of our really critical challenges is to be able to monitor the impact of these changes, in particular establishing a baseline. We have multiple systems in place to be able to monitor this, including a requirement that was in the original animal drug user fees to collect data on sales of medically important, or sales of antibiotics for use in food animals. And so we've been collecting that data, and we've actually proposed that we make some changes in the way that data is collected so that we do it by species and have better ability to track sales of antibiotics by animal species. In addition to that, we have the National Antimicrobial Resistance Monitoring System, which actually collects samples, isolates various important foodborne pathogens, and looks at the resistance patterns. And that's yet another way for us to be able to monitor the impact of these changes. However, one of the very important aspects of this is actually to be able to drill down and get some information about what's actually happening on the farm. And we had a meeting last September that we held jointly with USDA and CDC to put together the framework for being able to do this. Unfortunately, we don't have the funding to be able to implement it, and so we're trying to work on what the options may be to be able to accomplish this, because it's really critical that we establish the baseline. In 2017, we are proposing moving some of the resources that we received on the human side, not to say that they're not also very much needed, to move them over to the veterinary side to be able to do some of these activities.
Well, thank you for your response, and I would just, I would express my alarm and concern that there isn't sufficient funding, and certainly encouraging you to do whatever is possible in this committee to support you in that, in making sure we do have good baseline data and that we are able to follow what happens after this directive comes into place.
Thank you.
Thank you, Mr. Chairman. Coming back to shrimp again, I'm glad my colleagues on the other side see that this is an important issue. But to follow up on your risk-based approach to inspect shrimp being imported into our country, funding has been provided. It was provided in the FDA in fiscal year 16. I think you received an additional $5 million to look into foreign high-risk inspections, and how are you using those funds? Are you using the data that's available? Or are you trying to depend on growing the full-time employees at FDA? Because I know you can't cover all these nations and all these risk areas, but if there's data out there that you can use to target these risk-based businesses that we know are sending polluted shrimp, or trying to send polluted shrimp to America.
So that's the way that funding is being used, to be able to put together as many information sources as possible so that we can most appropriately develop the risk framework for the inspections and the sampling.
So it helps when we have lacks of resources. We can't really afford, hiring all the people to do the job.
So
we use contractors, use data.
Well, we have to make maximum use of the resources that we do have available.
Okay. If you give me a second. And going back to rice. Will the risk assessment or other guidance establish a regulatory, whether it's enforceable or unenforceable, limit on the amount of arsenic in rice or rice products?
So the risk assessment is what it says that it is, which is a risk assessment. But what we are hoping to do in concert with the risk assessment is a risk management plan. So that's also a very important component of what it is that we're doing, as well as how we would engage in risk communication about the information that's contained in the assessment.
Do you know what type of level it's going to be, whether it's guidance, regulatory, or
again,
action?
it's still being worked on.
Still being worked on. Since arsenic is an element common in soil, water, and most foods, what authority are you using to regulate this naturally occurring substance? And has the authority changed since the issue was raised early last year? And if so, why?
So it is a naturally occurring substance, and rice seems to disproportionately absorb arsenic from the way that it's produced and from the soil and from the fact that it sits in a lot of water. And so, we've been, not only are we doing the risk assessment and looking at ways to reduce any health risks that may be associated with the presence of arsenic, particularly inorganic arsenic, and taking a very comprehensive approach, not only in terms of what standards may be in place, but also ways to be able to reduce that absorption and ways that the actual amount of arsenic that may be present in rice that is consumed can be reduced.
Is the FDA planning on limiting any other foods that you're aware of? Issuing limits on other foods similar to what you're reviewing with rice right now?
We always are reviewing information about health risks in the food supply and taking actions when they're necessary.
Thank you, Mr. Chairman. I don't know if anybody's craving shrimp quesadillas right now, but I am.
Thank you very much. I want to talk about congressional directives regarding the FDA foods program. The enacted FY16 Agriculture Appropriation Bill contains a number of other policy riders for a range of programs that are related to FDA's foods program. Not all of the provisions are directly related to food safety activities, but involve other FDA food programs. For example, the enacted law prevents the use of any funds to, 1, implement the 2015 dietary guidelines for Americans unless the Department of Health and Human Services and the U.S. Department of Agriculture comply with specified requirements. 2, prohibits the implementation of policies that would require reduction in the quantity of sodium contained in the federal reimbursed meals, foods, and snacks sold in schools below a certain level set in the regulation. And 3, enforce FDA's final regulations regarding restaurant menu labeling. The FY16 appropriation also allows states to grant exemption to schools from certain whole grain requirements that took effect in July of 2014, and it asserts that no partially hydrogenated oils shall be deemed unsafe or adulterated until FDA's formal phase-out starting in June 2018. The Senate committee report further expresses concern that FDA has not published the results of its study of consumer responses to nutrition labeling regarding added sugars. Can you describe how the FDA has responded to these congressional directives within the agency's food program? I note that FDA's preliminary responses to some of these requirements are discussed in your justification of estimates for the Appropriations Committee. So would you address that for me?
So not all of those things that you cited fall under, FDA as opposed to USDA, but what I can comment on are a couple of the things that you mentioned. One of them is the issue of the partially hydrogenated oils, and as you're probably well aware, in the middle of last year, we did issue a final determination that trans fats, which PHOs are the primary source of trans fats, would not be considered generally recognized as safe, and there is a 3-year time period for them to be phased out of the food supply. We also did offer opportunities for petitions to come into the agency that would help inform the determination that was made, and so in the interim time period before that actually takes effect in 2018, we will be considering any petitions that come in. As far as the nutrition facts label, as I was mentioning before, we did put a reproposal out last year related to added sugars, and that included having a dietary a reference value for added sugars, and the proposal that was issued, which is consistent with the dietary guidelines, is that in the average diet, 10% of calories should be in the form, not greater than 10% of calories should be in the form of added sugars, and that's the direction that we've been going in with the nutrition facts label.
Thank you, sir. That's all I have.
Thank you, Mr. Chairman. Just having a very important conversation. My colleague, Ms. Pingree, was here and talking about antimicrobials and that issue. And you're asking for data from drug makers out there, and I wonder how that is going. Are you getting the information that you need? What are you kind of specifically looking for? And if you're not getting what you need, what do you need from us to maybe help you out?
Yeah, so as you know, that provision to collect information on annual sales of antibiotics was included in the Animal Drug User Fee Act in 2009, and so we have been on an annual basis collecting that information and publishing reports on the findings. One of the things that I can say to you is that if you look at the trend that's occurred between 2009 and the last report that we issued, which was, I believe, in 2014, covering 2014 data, there's been a 22% increase in the use of, or the overall sales of antibiotics for use in food animals. And if you look just between 2013 and 2014, it's increased by 4%. And so the trend is certainly not going in the right direction. However, I do think it's important to point out that that's data that's being collected before the implementation of what was just discussed. And part of our hope is that when these are implemented, that we will see the trends change. As I also mentioned, one of the things that we think is very important to be able to collect as part of that information is sales by species, because that will enable us to be more focused in terms of if we don't see what we think we ought to be seeing as a result of these changes, it will help us better target where the problems may be.
Thank you. Keep us abreast of how this is going with data collection. I want to try to get a timeline here from the FDA on their draft guidance regarding animal drug compounding. And there's some concerns out there that the FDA's draft guidance on compounding from bulk drug substances could complicate veterinarians' ability to treat animals. And I wonder if you could address the timeline and what do you think how the next draft will incorporate changes reflecting the concerns of the stakeholders such as veterinarians?
Well, all I can say is that we always look at the comments that we receive very carefully. I can't give you a time frame. I know that frustrates Congressman Farr, but all I can say is that we will look very carefully at all the comments that we receive.
Thank you for being here, both of you. Thank you for your service. I
Thank
appreciate
you.
it. And I yield back, Mr. Chairman.
Thank you, Mr. Chairman. Dr. Ostroff, I want to say thank you for the designation of added sugars. I think that's a great thing, and thank you for the work you've done on menu labeling. And we don't have time here at the moment, but if you can get back to me on this recent bill that was passed in the House of Representatives and how that may undermine the work that you've done at FDA, to be responsive, quite frankly, to industry concerns and what would be the ramifications if this was passed into law. Also, another answer to a question is, can you tell me how and you can get back to me on this new Office of Dietary Supplement Programs is going to work, if you have the money to do that, and are you moving in the direction of pre-market approval for dietary supplements? Naloxone, the work that you guys are doing in terms of including reclassification of it as an over-the-counter medication, given the scale of the opioid, and misleading food labeling. I won't go through all of the recent article on food fraud and mislabeling. Recent discovery that graded products labeled 100% Parmesan cheese, in fact, contain higher levels of cellulose than are allowed under the law. This does have trade implications since we are in negotiation with Europe on these things, and I know that U.S. folks want to have these geographic indicators, but if we have a product that is misleading and is not what is in the product, we need to know that, and we rely on you to do that. But two questions I do want to address a little bit more substantively is the cucumber outbreak, and very serious. 6 deaths across 39 states, salmonella-tainted cucumbers, 888 illnesses, 191 hospitalizations. A public health crisis. What's happening, though, is cucumbers, as I understand it, and I'm not a farmer, but they have a two-week shelf life. But we are still, CDC is reporting additional number of consumers being sickened. So my question is, what's the agency doing to investigate all levels of the supply chain to determine the ongoing source of the contamination? Are you working with food retailers to ensure proper cleanup and decontamination? How are consumers still being sickened if the cucumbers have been recalled and the FDA has issued import notices?
So thank you for that question, and I wish that I had the ultimate answer to the last question that you asked, because it's something that we are following very closely and we are watching closely. I will say one thing, and that is that if you need an example of why what we're doing with FSMA is so absolutely critical, that particular outbreak hits two of the very critical aspects of FSMA. One of them is produce safety, and the other one is foreign suppliers.
Foreign suppliers.
Because, we've had in 2015 several outbreaks that have that particular combination, and it's why it's so critical that we make progress in implementing the produce safety rule, regardless of whether we're talking about produce from outside the country or inside the country, and that we move on foreign supplier verification so that we can do more working with our Mexican colleagues in the produce safety partnership to be able to address these types of problems. This was a very sizable outbreak, as you pointed out, and we, working with CDC, looking at various clusters of disease, were able to determine the distributor and the source of the distributor's cucumbers that led back to nearby Mexico. And based on that information, we issued 2 import alerts in September, and as a result of those import alerts, if you look at the data for that outbreak, about 88% of the cases occurred before we issued the import alert, and so they certainly look like they played a major role in reducing the risk associated with these cucumbers. But one of the things, as you pointed out, that we've observed is this very steady, low-level incidents of cases that are associated with the very same strain, and we've been working very hard throughout the supply chain, including doing extensive sampling of cucumbers that are being imported to see if we can identify other potential sources of why this is occurring, and whether or not it's that there are other sources where the salmonella happens to be in cucumbers that are coming into the country, if it's got something to do with the crates that they're packed in, or whatever it happens to be. This is something that we're looking at quite closely.
I'm going to try to sneak in this last question if the chairman will let me, and this is skyrocketing drug prices. United States and New Zealand are the only two countries that allow direct-to-consumer drug advertising. 2007 WHO made a strong recommendation against the practice, calling it, and I quote, a significant risk of exposing more patients to the adverse effects of new drugs. The federal law does not require the FDA to approve these advertisements before they are released to the public. The ads often run with erroneous or misleading information. The FDA can take action against these companies, but only after the ads have been aired and have been seen by the public, which can sometimes be too late. What's the FDA's capacity to review all the direct-to-consumer advertisements that get submitted for review? What is your timeline for review? What resources or funding would you need to be able to review the ads in a timely manner?
Yeah, so what I would say is that because I don't have those specific figures available to me, it's probably something that would be best if we were to get back to you.
Okay, very, very serious issue, because we know that the direct-to-consumer advertising is absolutely linked to the increased health care costs. People see the ad, they think, oh my God, this is for me. They go to the doctor and they ask for and so there's very, very significant issues associated with this. Thank you very much, and thank you, Mr. Chairman.
Okay, thank you. We've talked a little bit about tobacco and youth access and those things with the deeming issue. Premium cigars has been an issue. It doesn't have that youth access issue that and they're only sold in adult establishments. The goals of the Tobacco Control Act were to limit youth access, as you know, and prevent negative health effects from habitually used products. Neither apply, my understanding, to premium cigars. The question is, should FDA, and your thoughts on FDA leaving this category out of the regulations?
So again, I think that you know what was in the proposed rule related to cigars, particularly premium cigars. We asked several questions and we solicited comments about how premium cigars ought to be addressed, and I can't presage what may be in the final rule. However, I know that we have looked at available information regarding how premium cigars are used, and I think that you may be a bit surprised at the fact that there actually are younger individuals that do use premium cigars, and so even in younger folks, particularly those over 18, they are used.
You're used for ages over 18, though, right?
Yeah.
We've seen some situations in the past where the administrations in the past have decided to release controversial and unpopular regulation in the last few months of an administration that is not returning to power. And I guess the question would be to you is, could you inform the subcommittee if there are any regulations that are a priority to FDA that may be released before President Obama leaves office, and even if there are no specific plans for release of regulations, what might be on FDA's agenda toward the end of the year?
So, as you may imagine, there are many things that we've been working on throughout all of our product categories. Certainly one example, and I said without question when I took over as the acting commissioner, the deeming rule was a very high priority, and we are working very hard to try to get that to final because of the recognized public health implications. And so, that's certainly one. And then you know, there are activities going on, especially related to, you know, various guidances such as the menu labeling guidance that we're working on, some of the other things that I think were discussed over the course of the hearing. All of these are things that we're working on trying to get final as quickly as we possibly can.
Many of our domestic producers are concerned that they are disadvantaged when it comes to treatment of imports that be on the same comparison level. The regulatory industry, or the regulated industry, has very strong concerns that as it relates to the implementation of the FSMA regulation. According to FDA's 2010 report to Congress, the agency estimated there were over 300,000 facilities in 100 different countries that produce products that enter the United States and over 300 ports of entry. Despite significant funding increases from this Congress, FDA increased foreign inspection from 1,339 to 1,357, or about 18, between 2014 and FY15. Foreign inspections in general are often impeded by exporting countries such as we saw in China, a country that exports quite a few food and medical products or ingredients to the U.S. The Chinese government has not been completely cooperative when it comes to granting timely work visas for inspectors. And of course, the fewer the inspectors we have in place, the fewer inspections that they can perform. Once FDA put staff on the ground, they seem to have different rules for notifying firms of FDA's plans to inspect facilities. Does FDA give notice to facilities in the U.S. when it plans to conduct inspection for all products under its authority?
Well, it depends on the reason for the inspection. And so to the degree possible, we do work with regulated industries regarding inspections, but there are sometimes where it's more appropriate to do an unannounced inspection depending on the circumstance. What I can say is that one of the core principles of FSMA, as you very well know, is that we have parity in terms of the safety of foods that are produced domestically with foods produced internationally and imported into the country, and that we have equivalent levels of food safety, and that we have equivalent levels of oversight and regulation of what is required in the FSMA rules. It doesn't make any difference if it's produced domestically or produced overseas. And so being able to assure that we have equivalent levels of safety, and there are a variety of ways to be able to do that. It isn't simply inspections. To do that is really quite important. I mean, another example is that one of the other rules in FSMA is third-party certification. And we also are very aggressively moving towards systems recognition. We already have systems recognition in place with New Zealand, and we'll hopefully in the not-too-distant future have the same with Canada and with Australia, because what we don't want to be doing is we don't want to be investing our resources in areas that have equivalent levels of food safety that we have in the United States, so that we can focus our resources on where they're needed.
I think the concern is probably China, and do we have different standards in place for places like China than we do in the United States?
Well, not under FSMA. I mean, that's part of the principles of FSMA, is that there has to be an equivalent level of implementation of the various FSMA requirements, regardless of where the food is produced.
Well, in China, as it was mentioned last year, in China, investigators posted posted in country generally provided a few days' notice for routine inspections unrelated to a public health emergency. And if there's a potential significance in public health risk, in country investigators can perform cause inspection within a day and unannounced when necessary. So, you know, it seems like there's maybe a different standard.
Well, you know, part of the reason to have our, you know, an office in China is to be able to work as closely as possible with our Chinese counterparts. That's a win for us, and it's a win for them as well. And we would rather be able to, again, raise the standards, which I think that we've been doing by working with them, especially in helping them incorporate some of the FSMA standards into their regulatory requirements, so that we're not in always a position that we have to continuously take actions.
Have you experienced any delays in receiving visas from the Chinese government?
So, this was an issue a couple of years ago that has been resolved, and we're not currently having problems with obtaining visas for individuals that we want to place in our China office. We have 10 new positions that have been established. 6 of the individuals are already in place. 4 of them are being processed to be able to be relocated over to our China office, and so we're not quite having the same problems that we did several years ago.
Mr. Farr.
I want to follow up on your China questions, but if you are going to promulgate any new rules or medication, I hope with the craziness going on in American politics right now that you'll bring the mental health drugs up to the priority, because this country needs a lot of them right now, including Congress. On the Chairman's questions about China, interest in some staff around here about the jerky dog treats from China. I mentioned in my opening comments that you regulate dog food as well, and the jerky pet treats that were imported from China, I think exactly a year ago, the FDA said the reports that 5,800 dogs had, and it included had been affected in more than 1,000 canine deaths. The last reports that we could find on your website was last Tuesday, and that was issued a year ago. Can you update us on the investigation, on the work you are doing with CDC, and what the findings of the joint CDC-FDA study might be? Let me just read all these, and then you can respond at once. In the past, the FDA has issued this, that it no longer has problems getting into inspect facilities in China. But in response that you just gave to the chairman and the inspectors in 2012 that tried to get into the pet food plants, it appears that while FDA inspectors got into the plants, they got the runaround from the Chinese and were not able to take any samples, their own samples, to be tested. Has that changed? Do you have unfettered and unrestricted access to all the inspections, not just those related to pet treats? And I know you have issued a detain without physical examination orders for some Chinese pet food manufacturers. Have these detained without physical examination orders had an impact on the volume of pet treats imported from China over the since it was done a couple of years ago? Do you know how many Chinese pet food manufacturers are still shipping pet treats to the United States?
Yeah, so obviously these are specific pieces of information that we're going to have to get to you. What I can say is that the issue of the pet jerky treats is something that we devoted a lot of energy and resources to trying to figure out exactly what was happening. And that included collecting samples of various types of jerky. It included doing autopsies and various dogs and et cetera. And it's my understanding, at least, that the actual causation, I mean, and what precisely is going on is still a question. What it does appear to be the case is that the problem seems to be decreasing for whatever reason.
Do you take those samples in China, or those are samples from the stores in here? Shouldn't we try to stop stuff before it even gets into the United States?
Well, in trying to figure out what the causes of this, which is not that straightforward, it's been looking at samples, even in some instances that the consumers were providing to their pets. And so, we've been trying to address this at all stages along the continuum. But again, it's been difficult to be able to ascribe a particular cause to the problem. In other words, what's actually going on here and causing the problems. And so it remains something that we've been actively investigating.
But didn't you stop a lot of the certain manufacturers from importing these treats?
You know, again, it was a matter of, you know, we did take various actions, including import alerts in 2014 to be able to address this problem. Again, it does look like, in terms of the occurrence of the problems in the pets themselves, it appears to be abating.
Appears to be abated?
Abating.
Abating. Fewer deaths, still.
Fewer
there's
problems
still-
than we saw in the past, yes.
So what does that all mean? You're just going to continue to monitor, try to find the...
We will continue to work on this problem until we've been able to solve what's happening.
Right.
Without objection, I've got a letter that I'd like to submit for the record. It's signed by 109 members regarding the development and treatment of a rare disease called Duchenne muscular dystrophy, and I'd like to submit that for the record. Just in closing, when we did the 2000 FY 2016 omnibus bill, there was a restriction in there regarding the editing of genes in human embryos. An advisory committee on ethical practices regarding genetic engineering of human embryos at the request of FDA and in conjunction with the National Academy of Scientists recently gave a green light to, quote, go forward, but with caution, end quote, with certain forms of genetic engineering. And I understand that the main focus of the committee was due to the eventual dream of trying to eliminate terminal diseases and also debilitating diseases. But the fear among many and on this panel and, of course, constituents, and I know there are different opinions on this, but there was the risk of unintended consequences with genetic modification has the potential to create new defects and/or disease. Given that FDA requested this advisory committee's work last year prior to the congressional restriction being in place, it makes some wonder whether FDA is actively engaged in the process. Can you confirm that the provision in the FY16 omnibus will prevent FDA from accepting applications at this time?
Yes.
And what is FDA's position? Well, clearly, based on what the restriction is, then I think that speaks for itself. So,
Yes.
with that, let me.
Would you yield on that? I'd like to just have some discussion on it. I mean, what the fear also was unintended consequences. This rule would prohibit the research that could be done on building organs and things like that. I think that the motivation here was to not allow designer babies. And I think we unanimously supported that. But I think the way the language came out, it could be much broader. So, I mean, I don't want to stop this research so it's going to move offshore, and America will lose all of this opportunity.
I don't think it went beyond just designer babies. I think it went, toying around with embryos. So
That's correct. That's what the language says.
What's it going to do to beneficial research?
Well, this is always the conundrum, and I think that when you look at the report that was recently issued by the National Academy of Medicine, they point out exactly this problem, and it's part of the reason that we went to them to ask them to take a comprehensive look, and this was specifically dealing with something that's called mitochondrial transfer for individuals that have, mitochondrial diseases, and so they provided a feedback to us in terms of the framework that may be appropriate to go forward in this area. And obviously we are looking very carefully at that report because it lays out very nicely what you just said, which is trying to balance the risks with the potential benefits. But we're very cognizant of what the language in the omnibus was, and that won't happen this fiscal year.
I mean, what will the consequences be then?
Any research activities that involve genetic manipulation of embryos won't occur in this fiscal year.
Is that a good thing for America?
Well, again, that's, the language very specifically was expressed congressional intent.
Well, I think you could debate that congressional intent, and we tried to make sure that it wasn't quite as extreme as I think it's being interpreted, but I think that's not a good future for this country in medical research. I agree with the chairman on some of the things, but I think if we're going to lose, this research is going to go on in the world. It's just not going to occur in the United States, and we're going to lose a lot of great minds who will be moving to other countries to be involved in research.
Well, thank you, Dr. Ostroff, for being here today, and of course, Mr. Tyler, for your assistance as well. And we wish you the best. I know you'll be very active, so we look forward to seeing you and continue to work with you in one facet or another. But thank you again for your service during this acting time. And
well, again, I said I'm not going away. So
right. No, well, that's why I say we look forward to working with you. So
thank you so much.
Just with a little bit different hat on.
And again, thank you for the opportunity to work with you over the past year. It's been a real privilege, and your assistance has been very helpful.
Yep. Well, all the best. Thank you.
You.